After watching this video, your perspective on your medicine cabinet will change forever. Last week, a friend called me. She said, "I keep forgetting things lately. Her keys, her appointments, even what she was about to say mid-conversation. She's 52 years old and thought it was early-onset dementia. She went to doctors, got tests done. The result? Her brain was perfectly healthy. So what was the problem? The answer was in her medicine cabinet. That pill she'd been taking every night for years was silently eating away at her memory. And what I'm about to tell you might be the most disturbing truth you'll hear this year. Millions of people worldwide are unknowingly taking medications that destroy their memory every single day. These drugs aren't illegal. They're sold over the counter. In fact, some of them are in everyone's medicine cabinet right now. In this video, I'm going to show you exactly 5 drug groups. I'll tell you which ones are silently poisoning your brain, what alternatives exist, and what you need to say when talking to your doctor. But let me tell you this. When you hear number 4, you'll probably be shocked. Because that drug might be the very thing you're taking every day for your stomach. Are you ready? Then let's begin. But first, do this. If you're someone who cares about your family's health, grab a pen and paper while watching this video, because you're going to want to take notes. First, we need to understand this. How does memory work and how can medications damage it? Your brain contains approximately 86 billion neurons. These neurons communicate with each other through synapses. When you learn or remember something, these connections strengthen. This is called synaptic plasticity. Now here's the critical point. For this communication to happen, your brain needs certain chemicals. We call these neurotransmitters: acetylcholine, dopamine, serotonin, glutamate. And here's the secret of how drugs destroy memory. Some medications block these chemicals, some prevent neurons from connecting to each other, and some reduce blood flow to the brain. The result? Slowly, silently, without you noticing, your memory erodes. Every year, thousands of people are diagnosed with dementia, but in some cases, the real culprit is medication. A study published in JAMA Internal Medicine in 2015 showed that people who regularly use certain medications have up to a 54% increased risk of dementia. 54%! That's an incredible number. But don't panic. This video isn't meant to scare you, it's meant to inform you, because knowledge is power. And armed with this knowledge, you can have a much more informed conversation with your doctor, ask about alternative treatments, and protect your brain. Now let's move on to the first drug group, and I promise you, this list will surprise you. The first and perhaps most dangerous group, anticholinergic drugs. You probably haven't heard this name before, but I'm sure you know these medications. Let's see if any of these sound familiar. Allergy medications, especially older generation antihistamines, some sleeping pills, medications used for bladder control, some antidepressants, nausea and motion sickness medications, some muscle relaxants. Yes, they're that common. Maybe right now there's at least one of these in your medicine cabinet. Let's break down the word anticholinergic. Anti means against. Cholinergic relates to acetylcholine. So these drugs work against acetylcholine. They block it. So what is acetylcholine? Pay attention, because this is very important. Acetylcholine is the most critical memory chemical in your brain. Learning, remembering, concentration, all depend on acetylcholine. Do you know what's missing in the brains of Alzheimer's patients? Acetylcholine. What do medications used to treat Alzheimer's do? They try to increase acetylcholine levels. And now think about this. With that pill you take every night for allergies or to sleep, you're blocking acetylcholine. You're going in the exact opposite direction. Dr. Shannon Risacher and her team at Indiana University published a groundbreaking study in 2016. They examined brain images of people using anticholinergic medications. The results were frightening. 1. These people's brains had physically shrunk, especially the areas related to memory. 2. Brain metabolism, meaning the brain's energy usage, had significantly decreased. 3. They performed much worse on cognitive tests. And the scariest part, these changes were seen even with short-term use, so saying, "I only used it for a few months," doesn't save you. Now, let's be specific. Which medications should you watch out for? Older generation antihistamines, those used for allergies and sleep. Diphenhydramine-containing sleep aids like Benadryl, Zizquil, Tylenol PM are very common. Some tricyclic antidepressants, while these are less prescribed now, they're still in use. Bladder medications, especially those used for overactive bladder treatment like ditropan or Detrol, some muscle relaxants like Flexeril, motion sickness medications like Dramamine, and pay attention, some natural or herbal sleep supplements may contain similar compounds. Please note, if you're currently taking one of these medications, never stop suddenly. This can be very dangerous. Instead, talk to your doctor, ask about alternatives. Are there alternatives? Yes, there are. For allergies, newer generation antihistamines are generally not anticholinergic. Medications like Claritin, Zyrtec, and Allegra penetrate the brain less. For sleep, melatonin, cognitive behavioral therapy, sleep hygiene techniques. These are safer alternatives. For bladder problems, some newer medications show less anticholinergic effect. Additionally, pelvic floor exercises can be very effective. Wait, I want to share something very important with you. Research shows that after stopping anticholinergic medications, the brain can recover. So there's hope, but the sooner you take action, the better. If this information surprised you and you want to share it with your family, like this video right now, because this information could save lives. The second group is perhaps the most controversial: benzodiazepines. These are medications prescribed for anxiety and sleep disorders. Valium, Xanax, Ativan, Klonopin. These names might sound familiar. Millions of people in the United States use these medications. And I'll admit, these drugs work. They rapidly reduce anxiety. They help with insomnia. They can stop panic attacks. But there's a cost. And this cost is something most people aren't aware of. A study published in the British Medical Journal in 2014 shook the world. Researchers examined over 9,000 people. Findings: Alzheimer's risk increased by 32% to 84% in people using benzodiazepines. 84%. And the risk was directly proportional to duration of use. The longer you use them, the higher the risk. So how does this happen? Benzodiazepines bind to GABA receptors in the brain. GABA is a calming neurotransmitter. It reduces anxiety, relaxes muscles, facilitates sleep. The problem is, with long-term use, the brain becomes dependent on this drug. The GABA system changes, and memory formation is blocked. Let me tell you about someone I know. A woman in her 60s from California. She had been using benzodiazepines to sleep for 20 years. "I can't sleep without this medication," she would say. Then attention problems started. She had trouble finding words. She was mixing up her grandchildren's names. Her family thought dementia had started, but the neurologist suspected the medication. Slowly, in a controlled manner, the medication was discontinued. And 6 months later, that woman was a completely different person. Her memory had returned. The word-finding problem had disappeared. This story shows you, sometimes the problem isn't in the brain, it's in the medicine cabinet. Very important warning: stopping benzodiazepines suddenly is very dangerous. It can lead to seizures, severe withdrawal symptoms, even death. If you're taking these medications, you must talk to your doctor. A slow, controlled tapering plan should be made. This process can take months, and that's normal. Are there alternatives for anxiety? Yes. Cognitive behavioral therapy. Research shows it's more effective than medication in the long term. Exercise, a natural anxiety reducer. Meditation and mindfulness. In some cases, SSRI antidepressants may be a safer option, but this is definitely something you need to discuss with your doctor. Remember this: not everyone who uses benzodiazepines will get dementia. They increase the risk factor, but it's not the only factor determining your fate. Genetics, lifestyle, other health conditions all play a role. But if you've been using these medications for a long time, it might make sense to talk to your doctor about, do I really still need this? The third group is somewhat controversial, and I need to handle this topic carefully because statins, cholesterol-lowering medications, may have saved millions of lives. They reduce heart attack risk. They lower stroke risk. They're genuinely beneficial in cardiovascular diseases. But an unexpected side effect is seen in some people: memory problems. In 2012, the Food and Drug Administration, FDA, added a warning to statin medication labels, reports of memory loss and confusion. This wasn't a small decision. The FDA doesn't add such warnings randomly. So, how might statins affect memory? Here's the interesting part. About 25% of your brain is made of cholesterol. Yes, you heard that right. Cholesterol plays a critical role in the brain. It forms the membranes of neurons. It supports synapse function. It even plays a role in producing certain hormones. Now, I need to maintain balance here because 1. Not everyone experiences this side effect from statins. Most people use them without problems. 2. The cardiovascular benefits are real and proven. 3. High cholesterol also threatens brain health. It clogs arteries, increases stroke risk. But some people should be more careful. People who started having memory complaints after starting a statin, elderly individuals because the brain is more sensitive, those who are genetically more sensitive to statins. If you're using a statin and memory complaints have started, 1. Talk to your doctor. Maybe you can try a different statin. There are different types. 2. Dose adjustment might be considered. 3. In some cases, other cholesterol treatments instead of statins can be evaluated. 4. Lifestyle changes, diet, and exercise can sometimes reduce medication need. I'll say it again. Don't suddenly stop your statin. Your heart health may really be at risk. Make a smart decision by talking with your doctor. And here's the surprising section I promised you. The fourth group, proton pump inhibitors, PPIs. This name might not be familiar, but you probably know these names: Prilosec, Nexium, Prevacid, Protonix. Do you know how common these medications are? One of the best-selling drug groups worldwide. Millions of Americans use them. For reflux, for gastritis, for heartburn. In fact, some people take them over the counter every day. And here's the problem. These medications were designed for only 2 to 8 weeks of use, but people use them for years. A German study published in JAMA Neurology in 2016 was widely discussed. Over 73,000 elderly individuals were examined. Dementia risk was found to be 44% higher in people who regularly use PPIs. 44%, that's a very serious number. So how can stomach acid medications damage the brain? Several mechanisms are proposed. 1. They reduce vitamin B12 absorption. B12 is essential for nervous system health. Deficiency can lead to memory problems, even permanent nerve damage. 2. They can impair magnesium absorption. Magnesium is also critical for brain function. 3. There are laboratory studies suggesting they may increase beta amyloid accumulation in the brain. Beta amyloid is one of the markers of Alzheimer's disease. 4. They alter the gut microbiome, and we know that the gut-brain connection is real. Gut health affects brain health. Let me give you an example. A 55-year-old man from Texas who had been using PPIs every day for 10 years. He had reflux. The medication worked, he continued. Then he came with brain fog complaints. He couldn't concentrate. He couldn't follow what was being discussed in meetings. Words were on the tip of his tongue but wouldn't come out. B12 and magnesium tests were done. Both came back low. The PPI was slowly discontinued. Supplements were started. 3 months later, my brain fog lifted, he said. He felt 10 years younger. Now you might say, I have reflux. What am I going to do? Solutions exist. 1. Lifestyle changes really work. Losing weight, not eating late at night, elevating the head of your bed, avoiding trigger foods. 2. You can try H2 blockers like Pepcid or Zantac. These are an older drug group, not as strong as PPIs but sufficient for some people with fewer side effects. 3. If you need to use a PPI, use it at the lowest dose and for the shortest time possible. Use it as needed, not continuously. 4. Talk to your doctor. Maybe you really don't need a PPI. Maybe an endoscopy is needed. Maybe there's another underlying problem. And yes, the same warning again. If you've been using PPIs for a long time, don't stop suddenly. You might experience something called rebound acid. Your stomach produces more acid, symptoms temporarily worsen, taper slowly. How many people just realized they're taking PPIs? Write in the comments and share this video with anyone you know who uses PPIs. Maybe this is something they need to know too. And the final group, beta blockers. These are medications used for blood pressure, heart rhythm disorders, and sometimes migraines. Propranolol, metoprolol, atenolol, bisoprolol. You might be using one of these. Let's be balanced again. Beta blockers are life-saving medications. They're critically important in heart failure, after heart attacks, in dangerous rhythm disorders. But some studies show cognitive side effects, especially in the elderly. Especially beta blockers that cross into the brain, meaning lipophilic ones, cause more concern. These can cross the blood-brain barrier. How do they work? 1. They may affect the norepinephrine system in the brain. Norepinephrine is important for attention and alertness. 2. They can cause depression or fatigue in some people. These also indirectly affect cognitive function. 3. They can change sleep structure. And quality sleep is essential for memory. But I have to say this. The relationship between beta blockers and dementia is not as clear as other drug groups. Some studies find a relationship, some don't. In fact, some research shows that treating high blood pressure reduces dementia risk, because uncontrolled high blood pressure damages the brain. So what should you do? If you're using a beta blocker and memory complaints have started, talk to your doctor. Could there be a beta blocker that crosses into the brain less? Could you try a different blood pressure medication? Could dose adjustment be made? But again, suddenly stopping blood pressure medication is very dangerous. Blood pressure can spike, stroke risk increases. Now let's quickly summarize. 1. Anticholinergic drugs, allergy, sleep, bladder medications. They block acetylcholine, can prevent memory formation. 2. Benzodiazepines, anxiety and sleep medications. Long-term use increases dementia risk. 3. Statins, cholesterol medications. May have memory side effects in some people, but benefits are also significant. 4. Proton pump inhibitors, stomach acid medications, impair B12 and magnesium absorption, increase dementia risk. 5. Beta blockers, blood pressure medications, especially those that cross into the brain, can have cognitive effects. But now I want to take a step back, because this video isn't just about saying these drugs are bad. The real message is, be conscious. Every medication has risks and benefits. Your job is to understand this balance together with your doctor. Here are some important principles for you. 1. Minimize the number of medications. There's a concept called polypharmacy, using multiple medications. Especially in the elderly, as the number of medications increases, side effect risk increases exponentially. Question whether each medication is necessary. 2. Review regularly. At least once a year, talk to your doctor about, do I still need all these medications? Maybe that medication you've been taking for years is no longer necessary. 3. Use the lowest effective dose. More isn't always better. 4. Seek lifestyle alternatives. Diet, exercise, sleep, stress management. These can sometimes be as effective as medication. 5. Track symptoms. Has there been a change in memory, attention, or mood after starting a new medication? Take notes. Tell your doctor. Now let's move to the positive side. Because knowing medication risks is important, but what you can do to protect your brain is much more important. 1. Exercise. This alone is the most effective brain protective activity. Aerobic exercise, walking, running, swimming, cycling, triggers the formation of new neurons in the brain. Yes, even in the adult brain, new cells form, and exercise triggers this. At least 150 minutes of moderate intensity or 75 minutes of high-intensity exercise per week. It's that simple. 2. Pay attention to your sleep. During sleep, the glymphatic system in the brain kicks in. This is like the brain's garbage collection system. It cleans out toxic proteins. Insufficient sleep prevents this cleaning. Aim for 7 to 9 hours of quality sleep. Don't use screens before bed. Keep the room dark and cool. Go to bed and wake up at regular times. 3. Eat brain-friendly foods, Mediterranean diet or mind diet. These are eating patterns shown to slow cognitive decline. Leafy greens, berries, walnuts and almonds, fatty fish, olive oil, whole grains, these are your brain's favorite foods. What to avoid? Processed foods, excessive sugar, trans fats, too much alcohol. 4. Be social. Social isolation is a major risk factor for dementia. The brain is designed to work with social interaction. Spend time with friends, strengthen family bonds, meet new people, join a club or group. 5. Do things that challenge your brain. Learn a new language, play a musical instrument, solve puzzles, pick up new hobbies. The brain weakens when not used. It strengthens when used. But pay attention, just repeating the same things isn't enough. Your brain needs to be challenged. You need to try new and complex things. 6. Manage chronic stress. Cortisol, the stress hormone, shrinks the hippocampus over time. The hippocampus is the center of memory. Meditation, deep breathing exercises, yoga, spending time in nature. Stress-reducing practices protect your brain. 7. Address deficiencies. B12, vitamin D, omega-3. Deficiency of these affects cognitive function. Get blood tests. Supplement if deficient. After watching this video, I definitely don't want you to go to your doctor and say, "I watched a video on YouTube, I'm stopping my medications." That would be dangerous. Instead, you want to have a smart conversation. First, prepare. Make a list of all the medications you take: prescription, over-the-counter, herbal, vitamins, all of them. Write down how long you've been taking each. Remember why you started. Think about whether you've noticed any side effects. Then ask these questions. Do I still need to take this medication? Is a lower dose possible? Does this medication have known cognitive side effects? Is there an alternative with fewer side effects? Could I reduce this medication with lifestyle changes? Does taking these medications together create additional risk? Be alongside your doctor, not against them. They're your partner. Make the best decision together. And if your doctor doesn't listen to you, doesn't take your questions seriously, seeking another doctor is your right. Now let's pause for a moment. Why is this topic so important? We all have a grandmother, a grandfather, a mother or father in our lives. Maybe they're struggling right now. Maybe they can't remember like they used to. And maybe as you watch this video, you're thinking about your own future. What will I be like in 20 years? Will I recognize my children's faces? Will I be able to tell stories to my grandchildren? The good news is, cognitive decline is not inevitable. It's not genetic destiny. Aging doesn't automatically mean losing memory. Your lifestyle choices, the medications you take, how you eat, how you move, these are shaping your brain's future. This video is a starting point. Now is the time to take action. Check your medicine cabinet tonight. Make a doctor's appointment tomorrow. Start exercising this week. Review your nutrition this month. Every small step is a step that protects your brain. We talked about a lot in this video. Now here are a few final messages for you. 1. Don't stop your medications suddenly. It's dangerous. Work with your doctor. 2. Not all medications are bad. Some medications save lives. What's important is conscious use. 3. Lifestyle can change a lot. Exercise, sleep, nutrition, social connection, these can be as powerful as medication. 4. Knowledge is power. By watching this video, you've already taken the first step. Now turn this knowledge into action. 5. Never give up. Your brain is an incredible organ. It can change, heal, strengthen, no matter how old you are. If this video gave you valuable information, take a moment and subscribe. Because on this channel, I share the information you need to protect your health. Hit the like button. This tells YouTube that this video is valuable and helps it reach more people. And most importantly, share this video thinking of someone who takes medication, an elderly relative, a friend who needs to pay attention to their health. This information could change someone's life. I'm curious about this in the comments. Are you going to check your medicine cabinet after this video? Are you planning to talk to your doctor? Which medication surprised you the most? I read and respond to your comments. I want to hear your story. Remember, your brain is your most valuable asset. Protecting it is in your hands. See you in the next video. Stay healthy.